So what we're going to do is start with Paul saying, or Professor Romer, giving us some perspective from his macroeconomic background about what the key issue that needs to be resolved right now is. And then we're going to turn to Raj, who's going to give us some of the answers, hopefully, and maybe some reasons for cheer. So, Professor Romer, over to you.
I think it helps to start at the personal level to give people an appreciation of the role that testing can play in prevention. And then I'll come back and link this to the economy. We think of testing as a diagnostic tool, as a clinical management tool, but here's how it can prevent the spread of this disease. My daughter works as an ICU physician in a major academic hospital. She has friends who work in hospitals in other cities like New York and Boston. When they come to work, none of them know if they're silent, asymptomatic carriers of COVID. So the way we should be using testing for them is that they should be able to get a test with results within 5 minutes every single day. And when that test reveals that one or two of them, a few of them, are actually carriers of the virus, they can immediately be isolated and we can limit the extent of the infection. Now, scale this idea out to all of the other essential workers that we depend on right now, the police force, the EMTs, even sanitation workers. We should have the capacity to test so that we can test them frequently. As we think that idea through, we see one, we need a lot more testing capacity. There are at least 10, 12 million people who work in healthcare, another several million in EMTs and law enforcement and so forth. So we need a lot more testing capacity. But as we think this through, what we can see is that in implementing this, we would not only slow even further the spread of the disease, then we get experience with the method that will actually make it safe for everyone else to go back to work. So the ultimate goal is to test everybody within every 2 weeks and have them isolate if they test positive, but otherwise let them return to work, return to daily life. And as that further slows the spread of the infection, we can start to remove in sequence all of the existing social distance measures and help the economy recover.
Raj, what do we do about this? Can we fix this anytime soon? Is there any way to marshal all the entrepreneurial efforts that are going on so commendably and all the brilliance of American research and all the money that's now flooding into this area? Is there any way to get any of this actually done as a solution?
Well, I think there is, and thank you, Gillian. Thank you, Fred, and the Center for hosting this conversation, and special thanks to Paul for your partnership in this effort and intellectual leadership. You know, it is, I think it's worth first just stepping back and noting what is it that we're in. And I fear that too many business and policy leaders believe, you know, we're in a 6-week period of threat and challenge, after which this will quote unquote burn out, and we will talk about it in historic terms. And that is just not the case. There are a lot of reasons why the world probably should be planning for this to be a 12 to 18 month crisis. We've seen the ricocheting that Paul and I wrote about. We just saw it happen in Singapore. Singapore by far was the most effective lockdown in the world. And they had the ricochet happen, and they had to, you know, do it again. And now they're in a period of again, sustained lockdown. So, you know, we're seeing a lot of reason to believe that this is going to be ricocheting between economic activity and lockdown over the course of the next 12 to 18 months. The only solution is the one Paul just detailed, which is knowing who has coronavirus and knowing who might have some potential immunity and therefore is safe.
So I'm wondering, can Rajiv or either Paul tell us, are other countries doing what you're asking for already?
Yep.
How and why?
Well, if I could just jump in, Iceland is a kind of a nice polar alternative to Singapore. Iceland is committed to testing everyone in Iceland for the presence of coronavirus. And this will give them the kind of access to data that Raj was just describing that can so help the effort to control the virus. and it will let them do it in a way that doesn't involve using, say, the police and detectives and tracking to follow people so closely. So there are various different strategies here that can work. The universal testing is one which I think is going to be less likely to raise concerns about civil liberties, and therefore one that we can come to a consensus around and implement very quickly.
The bottom line is we should have a super fast, super accurate oral saliva test that within minutes or less could tell you if you're positive. That should be, and our country should be willing to make a huge, massive investment in developing, acquiring, distributing that test, and using that test to restart our economy and avoid this ricocheting.
Gillian, if I could just come back, Raj said something earlier that I think is worth pointing out. We're talking about an approach that hasn't been used before to handle an epidemic. And I think it's worth explaining why this particular pandemic and others like it may need this new approach. When you've got so much asymptomatic transmission, things like the traditional contact tracing will not work. And so we really have to be careful not to let what we've done in the past be the only thing we think about now. This is different. But two, we can't let the perfect be the enemy of the good, practical right now.
And Gillian, could I add one thought? Maybe it's actually more a question for Paul, if that's okay, which is, I think Paul's done some really important economic analysis of that gives us a sense of a reasonable scale of investment against this task. Paul, do you mind just running through those numbers?
Yeah, I'm just going to use a quick analogy. When you think about scale, suddenly things seem possible that you didn't think about before. As a nation, just the United States or as the world, we have the resources to develop this kind of ubiquitous testing. And what would it save us? Right now, my estimate is that we're losing about $350 to $400 billion a month in reduced output in the United States. This is output that's not being produced, income that's not being earned every single month. So if we could spend $100 billion to scale out testing, and if that accelerated the recovery, brought it forward just 1 month, we'd be way ahead. We'd have a 4x return on our investment.
One other quick question, which is that in today's Financial Times up on the website, we have a truly brilliant account from one of our correspondents in China about how essentially China's been transformed by this traffic light app on their phones, whereby essentially people are being forcibly monitored and tracked by the Chinese government, and then given a kind of certificate on their cell phones in the form of an app showing whether they're either red, amber, or green and free to move around or not. Is that the future? Is that where we're going to end up? Would you support that as a way to reopen the economy? And how concerned are you about the civil rights issue there, or civil liberties?
Well, I'll go first because I've thought about this quite a bit. I do not think in the United States we can reach a consensus to do something that could be so intrusive, or even that risks being so intrusive. So I think we need a solution that is not going to trap us in months of discussion about will this protect privacy? How do we be sure that this, again, it's the fear and the paralysis that we really have to be afraid of.
I'm with Paul, and I don't think America can achieve a consensus fast enough, nor should it necessarily, to have Chinese-style facial recognition and surveillance tied to, government-accessed metadata on each individual. So, and we've seen in parts of China and around the world the incredible abuses that system enables.
We can have absolute privacy protecting methods that still solve this problem. And we need to have all of those on the table. And we need to encourage experimentation with those before we say that the only path forward is we gotta track everybody in real time.
Raj mentioned, quotes, a big national project, but this is actually an international topic. Is this project framework one that we need to agree on an international level?
Look, the response to COVID-19 absolutely has to be a global and coordinated response. So we absolutely need that. That said, I think America should just charge ahead and do the best it can as quickly as it can right now. But sharing best practices and overall having a global view on this pandemic is going to be critical.
One question I've had, in fact, several questions I've had is, so what practically are you going to do next, Raj or Paul? What can we look forward to in the coming days?
Well, to be honest, I'm going to try and look for somebody who'd be willing to set up a prize. Literally like $1 billion prize. If not that, 500 million, it'll whatever. But I think that kind of prize could mobilize efforts the way the Netflix prize did many years ago. I think this is the fastest way forward.
Well, Jack Dorsey, I hope you're listening. Raj, what do you plan to do
maybe we'll chip into Paul's prize, but I'd say three big things. The first is work together with Paul and a group of policy partners and advocacy partners and business leaders and scientists. We are going to work very hard to make sure the next congressional stimulus bill has some of these ideas reflected in it from an education and advocacy perspective, because we're a foundation and we don't lobby. Second, we've established a testing strategy group. I think it has a slightly longer name than that, but it's an effort to bring scientists, biotech executives, investors, public sector leaders together to understand and start to detail out what a national strategy would look like to accomplish this task. And third, we're actually investing in mayors and governors who are on the front lines of this right now. Later this week, we're going to announce a few $1 million of grants that will help support what we think are the best examples of advancing testing in this manner, so that we can help those efforts go forward, even as we work to get a much bigger national project in place.
Terrific. Well, it's been an amazing conversation. I've learned a lot. Thank you for speaking so clearly and also in a way that's potentially very inspiring.